name is Chad Craig. I'm an internal medicine physician here at Hospital for Special Surgery. I work as a perioperative physician. Specifically, I work with the spine service. I also work as the medical director of the inpatient spine service here. My role is to work with the spine team to help identify patients that are perhaps higher risk, patients that are undergoing complex surgeries, and work to optimize their health both before the surgery, throughout the surgery period, and then post-operatively. Undergoing spinal surgery can be a very scary prospect for many patients, and so I really enjoy helping them through that process. And so we talk a lot before the surgery about realistically what to expect, and I enjoy that. It's one of the few fields within perioperative medicine where you really have the opportunity to influence outcomes. We talk about what the surgery means, what's being done to them anatomically, and then what to expect right after surgery with regards to realistic pain levels, functionally how quickly we're going to get them up and moving. And we talk about what we do to decrease complication rates. Patients undergoing spine surgery statistically have often more complications than other patients undergoing different types of orthopedic surgery. And so there's a real role for helping to identify patients that are at higher elevated risk and address those factors. So the goal is to identify the patient risk factors or the surgical risk factors as able and modify those to make sure that the outcome after the surgery is really the best it can be. What strikes me and patients alike is really the compassion and the dignity that patients are treated with here. And I see this, I think, on a day-to-day basis. And so it's one thing to expect an excellent level of care from an outcome standpoint. It's another thing, I think, just to be treated on a human level at all levels of care. And this is true, I think, with the nurses on the wards, from the surgeons, from the anesthesiologists. And so that's what I think really drives patients to choose HSS, to recommend it to their family and their friends.